Welcome back to Hey Baby and Beyond. I'm Lauren, an antenatal and postnatal teacher here in the UK. And in this video today, I want to share with you the real importance of birth partners and birth supporters during the labour process and birth and beyond. So quite often, partners or people's support network don't actually understand how important they are for the birth process itself. During pregnancy, partners might be there to kind of support the growing body and the baby growing and going to appointments and attending scans and things. But really having that excitement that the baby's coming is the main job, and keeping the partner comfortable and happy. But actually, your role for labour and birth is massive. And I don't stress this enough. I can't stress this enough, because having a good support partner during labour, one support partner, two support partners in you if you're in hospital, or more if you're in a home birth setting, is key to having a positive birth experience. So for partners to understand the preferences of the person in labour is important. And this is why it's so important that you do your research beforehand, so that you're not making these decisions and thinking about your options on the day of labour or mid induction or mid pushing your baby out. We need you to be fully aware of your options and your preferences in the pregnancy, so that you can go into this and advocate for your partner. So, what do we mean by advocating? What we mean is by protecting your partner's preferences and not being afraid to ask questions and question certain things that might be being offered. We want our partners and our birthing people to have a good, positive experience of labour and of birth, in a position where they feel well supported and they feel listened to. So knowing the preferences is the first thing, and not being afraid to advocate for it is the second thing. Just remember that this is your baby's birthday. This is your birth experience. This is the day that you're not going to forget, and we want it to be a positive one. We're not saying everything might go to plan and be perfect, if we can say what perfect is. But what we're saying is that we want you to feel like you took control, and like the situations were controlled, and that things were met in the way that you'd expect. So, if you have said that you don't consent to something, then that means that you don't consent to it. If you change your mind mid labour, this is about our partners having a discussion and saying, look, do you remember when we talked about this in pregnancy? Are you still feeling the same way, or do you want to change your mind? It might be about something such as a pain relief method, or it might be something such as, do you remember when we talked about, the one in epidural? It's going to take you away from being low risk in a birth centre using water. If you want to go down that route, that's absolutely fine. But if you're still wanting to stick to those things, then let's look at other options. Let's dig deep and let's kind of face this together and look at the other methods that we've learned. So you are being that protector of that space. You are going to be the one keeping that oxytocin hormone at its highest. You're going to be protecting it. You're going to be keeping the door shut, keeping the lights turned off, keeping your partner calm, not encouraging her to embracing any conversations with other people. Let her focus. Remind her of positive affirmations, using some positive counter pressure on the back, the shoulders, the hips, making use of things that you've used in pregnancy, such as breathing techniques, positive affirmations, and just giving that confidence and empowering her to continue the way she is, and to know that her body knows exactly what she's doing, and the sensations that she's managing are the way they should be, and they are things that we'd expect from labour. So your role as a birth partner is massive. And what I do say to birth partners is that you need to be looking after yourself during the labour process. So if you need a breather, you need some fresh air, take a step outside, take a breather. If you feel like you need something to eat and you don't want to necessarily do it in that room because maybe your partner's in a zone and you don't want to disturb her, then again, take a step outside, take a breather. Your midwife will be there to guide you on the time that it is right to do so. And if you're not sure, ask the question. The second thing is remembering to ask lots of questions. You can never ask too much. So if something's being offered, why is it being offered? If it's being offered and you're not too sure whether we're going to go down that route just yet, ask for more time. If something was ever an immediate threat to the birthing person or the baby or the labour, you would not be given options in that sense. It would be, we need to do this now. But if that's not happening, there's usually time to talk about things and discuss things and make a informed decision on what's right for yourselves and for your labour and for your baby. So what I just want is all birth partners, all birth supporters, anybody who's going to be a birth partner, to be empowered, to know that you can control this situation, that there's lots of things you can do to enhance the situation, to encourage this positive experience, and to protect that space and the birthing hormones to encourage a more physiological birth with less intervention. If you've got any questions about this, if you're going to be there to support someone in labour and you've got questions, pop them down below. If you are the person giving birth, send this video to your birth partners, tag them below, make them aware that their role in this is massively crucial to your birthing experience and to your baby's birth. I hope you found this video useful. If you did, again, don't forget to subscribe. Let's get these videos out there. Let's get them accessible to people and let's empower people to have a better birthing experience and a more positive birthing experience.